A Tale of Two Hygienists presents this week's TIPisode, quick and easy tips to keep you up to date and presented by the experts in the profession. Now, get ready for your unofficial TIPisode.
Hello, fellow dental professionals. Dr. James Younger here, practicing dentist and the founder CEO of TempStars, North America's fastest growing dental temping and hiring service. And thanks again to Andrew and the team at A Tale of Two Hygienists for giving me the opportunity to speak to you today in this TIPisode. Today I'd like to talk briefly about my clinical practice, and thanks to Lacey from A Tale of Two Hygienists team for the idea to talk about my clinic at the mental health hospital today. So I've been a practicing dentist for about 23 years now, and I started a dental practice from scratch, and I've purchased an existing high-end practice, and so I've been through all of those sorts of things, the business of dentistry and the running of private practices. But today I'm out of private practice now, having built and running TempStars, but I still love doing clinical dentistry, and right now my clinical care is at a center for mental health. So if I could offer some value or insight in this TIPisode, I thought maybe it'd be helpful to describe how I provide care in a way that I just personally call it kind of extreme patient permission-based care. So, as we know, mental health has a cyclical nature, and so patients with mental health challenges, they could be having good days and sometimes days that aren't so good. And so from the time a patient comes into our clinic, I'm always just very calm, pleasant, helpful, and I don't have an agenda at all. And for me, that's just also part of my nature as well, but it's something that I really think about as when a patient walks in, because depending on how they're doing that day, we don't want to set up resistance or defensiveness or things like that, and we want them to feel welcome in a caring environment. And so they come in, and yes, we might have treatment planned in the schedule for that appointment, but it's not to say we're not or are going to accomplish that treatment that day, and it's okay if we don't. And so just a couple of examples of ways I approach a patient and things I say that really help the appointments go smoothly and allow our patients to feel more receptive to the care we want to provide for them and that sort of thing. So so somebody walks in, let's say we have them scheduled for a filling, and I say, hey John, how are you? And today in the schedule we've got you down for a filling, but is there anything else you've got going on in your mouth that feels more important to you that you'd rather I look at instead of this filling? And they might say, oh no, everything's fine, let's just go ahead and do the filling. Or, I haven't been here in a month, but man, this tooth is really hurting me now, or this one is bothering me more, that sort of thing. And even from there, I can say, oh yeah, I can see. Now that tooth, that's just a little bit of root sensitivity. We can certainly address that, but this cavity we were going to fill today is getting a bit deep, so maybe that should be the more important thing we address today, but we can see you back to do that sensitivity, or just add it to the appointment. But just to kind of touch base with them to see how they're doing and how their teeth are doing. So another one, it might say, okay, if they come in with a broken and infected tooth, and it's just, I would say something like, oh, it looks like this tooth is really broken, and it's so broken it got infected. So the way it is right now, the only thing I can do is just leave it that way, or I can take it out for you if you want. But the problem is if we leave the tooth there, it's going to keep hurting and might make your face swell, and you could even get sick from the infection. So it's a good idea to get it out, and what do you think about that? And so again, just a conversation, permission-based, that sort of thing. Or if we're going to do a filling or an extraction, and I say, and maybe we don't yet have a PA of that tooth, and I say, okay, here's the plan. I'm going to put some freezing in. While the freezing's kicking in, Pam's going to take an x-ray, and then when we're sure it's numb, we'll do the filling and fix that tooth. How does that sound? And so again, permission-based, just explaining the plan, that sort of thing. And then maybe we see a patient for the first time, and they're nervous, and what is this dental office about? And maybe they're in a situation where they're used to kind of being told what to do, maybe because of their mental health challenges or things like that, and they come in a bit defensive. And so I might say, oh, hey John, I'm James the dentist here, and someone sent us a note asking me to take a look at your teeth. Is that okay? And you don't have to worry. I'm never going to do anything you don't want me to do. We're not going to force you to do anything. We're not going to make you do anything. I'm just here to help you, and if it's okay, I'll just take a look at your teeth with a mirror for now, and we can just kind of see what's going on there. So you can kind of see how there's nothing really that I'm telling the patient that I'm going to do. It's just all kind of explaining and asking permission. And sometimes the patient might not be having a good day, and if that's the case, then we just reschedule them for another time. And if this is helpful, and I know we learn these things in school, and for the most part, many dental professionals and clinicians do practice forms of this. But if it's helpful, often we have a busy day in the office, right? We've got a tight schedule, production goals, and other performance expectations. And so we all have these things on our mind in addition to providing this great care to our dental patients. And those are all normal things about running an efficient, high-performing practice. But sometimes without thinking about it, if we're thinking of pursuing these goals, expectations, production schedule, all of that, patients can kind of sense that, and it might trigger some pushback or resistance from them, from our patients, if they sense that we have an agenda other than the care that's best for them. And I know it's not feasible to do exactly what I do at the mental health hospital in a clinical practice. It's just not. I mean, there are just realistic things that go on in the business of a dental practice that make it maybe not feasible to do those exact same things. But I think that the concepts are worth talking about and considering as a communication style when we're talking with our patients. And I also know that sometimes we know the best thing for our patients, of course, and we know their best choice. And sometimes we do a little bit of manipulation or a nudge or some flavor of kind of not coercion, but trying to help them make the best decision in their own best interest. And still, that's not a business schedule agenda, but that's us just kind of massaging the situation to kind of get them to do the thing that we know is best for them. And we're still acting out of their best interest. But I just think it's worth considering and maybe incorporating different flavors or versions of this, what I call this permission-based care concept when we approach our patients. It helps set them at ease. It helps them realize that our only agenda is to listen to them, connect with them, and care for them. And even all of those things, when they feel that way, they certainly will be less resistant and more open to receiving the care that we need for their oral health. So thanks again for listening. I'm just going to do a quick plug for TempStars here, if you don't mind. We've recently expanded our service to Boston, Chicago, Philadelphia, Pittsburgh, Nashville, and Phoenix, Scottsdale, and things are growing faster than even expected. So even though probably just in the last few months you started hearing about TempStars, we've completed over 75,000 temping shifts to date. We're on track to break 100,000 temping shifts in the first half of this year. So we really know what we're doing. We've got a great team who genuinely cares about improving the work lives of dental professionals. We specifically keep our fees as low as possible to give dental offices more wiggle room when considering your hourly rates for temping shifts. We have a payment guarantee, so you're not chasing around offices for payment after the fact after a temping shift. We have a short notice cancellation guarantee so that you're compensated if a dentist office cancels last minute, so you're kind of not left hanging. And we don't charge anything for hiring. So we don't charge thousands and thousands of recruiting dollars. If you're working at a dental office and they say, oh, we're actually looking to hire someone, can we hire you? You don't even have to tell us. You can just, if you found a great office and you think that would feel like your work home and you want to work there, we don't offer any resistance to that. We don't want an office hesitating to hire somebody fantastic because of a recruiting fee or things like that. So no fee for hiring. We've got a couple of neat things that are newish. We're launching our Spring into Action contest very soon to win cash prizes and up to $1,000. And so keep your eye out for that. We're going to be sending out some emails and doing some promotions about that. And we've also recently launched our affiliate program. So there's an opportunity to refer friends and colleagues and to kind of earn an ongoing passive income through referrals and things like that. So check us out at TempStars.com. Thanks for listening, and I'll see you at the next TIPisode.
We hope you enjoyed this week's TIPisode. Be sure to reach out to our guest experts and let them know how helpful their tips were. Follow A Tale of Two Hygienists on Facebook, Instagram, and head over to ataleoftwohygienist.com and subscribe to our newsletter. You can also email us at ataleoftwohygienist@gmail.com and keep listening for more awesome content from your unofficial dental hygiene podcast.